everyone, and welcome to our Medically Unlikely Edits, Reduce Improper Payments webinar. My name is Mary Mucko. I'm a specialist on the Provider Outreach and Education team at WPS Government Health Administrators, or WPS GHA. I will be your speaker today. Assisting me is my friend and colleague, Ellen Barra, who will help during the question and answer portion of the call. We begin our webinar today with this disclaimer. We include this in all our education, and the purpose is to inform learners that we made every effort to ensure that the education we provide is current and accurate. The information, though, is subject to change. CMS publishes relevant laws, regulations, and rulings on their website. Answers to questions are based on the facts given. But remember that CMS published instruction and rules will always prevail, and this is what determines final coverage. CMS prohibits use of any form of recording of this presentation for profit-making purposes. We are recording this event and will post the recording to our Encore Presentations webpage, where it will remain for about 90 days. The recording will also be available on the WPS GHA YouTube channel until we decide to remove it. In our webinar description and in our advertisements, we stated that during this event today, we will discuss what our National Correct Coding Initiative, or NCCI, Medically Unlikely Edits, MUEs. I'm going to talk about how to find MUEs, and we'll also talk about how to use the MUE tables. It is CMS that implemented the initiative to reduce improper payment and help ensure correct coding for Part B claims. This is called the National Correct Coding Initiative, or NCCI. CMS publishes the NCCI edit files on a quarterly basis, and these files include any deletions and revisions or additions. In addition to the files that are posted on a quarterly basis, CMS also publishes a Medicare NCCI policy manual, and this manual is a tool for correct coding. If you've never looked at this manual, I highly recommend that you do so. It is a fantastic tool. It contains a lot of great information that really helps explain rationale for the edits. Unlike the quarterly updates to the edit tables, CMS updates the manual once a year. The additions and revisions will appear in red font. If you need to refer to prior versions of the manual, you can find it in the Medicare NCCI Policy Manual Archive, and I've provided a link for you at the last bullet on this handout. You will find throughout this presentation, when you see any blue colored font, that those are actually hyperlinks to just many resources that I'm providing during today's webinar. With just a couple of exceptions, those that are listed on this slide, the NCCI Policy Manual chapters actually correspond to separate sections of the CPT manual. For example, there are chapters for anesthesia, surgery, radiology, pathology, and laboratory services, just to name a few. The introduction in Chapter 1 of the manual is one of the exceptions. That doesn't correspond to separate sections of the CMS CPT, or the CPT manual. Chapter 1 of the manual, the NCCI Policy Manual, is an excellent resource for basic information and proper coding practices and coding edits. Chapter 12, also shown here as an exception, discusses HCPCS Level 2 codes. And then Chapter 14 discusses Category 3 CPT codes. MUEs, medically unlikely edits, are edits, just as the name implies. Then these exist to reduce improper payments in the Medicare Part B program, or in the Medicare program. There are other types of edits, but this webinar today focuses on those medically unlikely edits. They used to be called medically unbelievable edits. All claims that are submitted to MACs, Medicare Administrative Contractors, including the Durable Medical Equipment MAC, and Outpatient Facility Services claims, those with types of bill 13X, 14X, and 85X, are subject to MUEs. MUEs are the maximum units of service that a provider would report under most circumstances for a single beneficiary on a single date of service. So since MUEs are coding edits rather than medically necessary edits, claims processing contractors may have units of service edits that are more restrictive than the MUEs. In those cases, the more restrictive claims processing contractor edit is going to apply to the claim. Similarly, if the MUE is more restrictive than a claims processing contractor edit, the more restrictive MUE will apply. You should only report services that are medically reasonable and necessary. And just as a reminder, MUEs are not intended or not meant as utilization parameters. There are several considerations when developing MUEs. This slide lists them. You can see some considerations include HCPCS or CPT code descriptors, anatomic considerations, nature of equipment for those that are durable medical equipment MAC MUEs, prescribing information, and then of course clinical judgment. And these are just a few of the considerations when developing an MUE. There are different ways to find MUEs. You can navigate to the Medicare NCCI Edits webpage and choose Medicare NCCI Medically Unlikely Edits, or MUEs, from the menu on the left, and then you need to scroll to the bottom of the page for the table that you want to view. Or you can find MUEs by linking directly to the web page and setting a bookmark. If you're like me, I'm a searcher, not a navigator. I simply just, if I'm out on the CMS website, I simply just type NCCI in the search box to find the NCCI edits, and then I choose the one that I'm specifically looking for. Either way, when you navigate to the medically unlikely edit page on the CMS website, you will find links to tables for the current quarter in the related downloads near the bottom of the page. Now remember, if you're seeking edit tables for previous quarters, you're going to need to use the link listed on the bottom of this slide, and that's going to take you to the MUE archive. So let's take a look now at what that page looks like. I mentioned to you that there are multiple ways of finding the medically unlikely edits, and one is to go here to the Medicare National Correct Coding Initiatives edits webpage, and then choose from the left menu items Medicare NCCI Medically Unlikely Edits. If you click on the link, you will then navigate to the Medicare NCCI Medically Unlikely Edits webpage. You can see, as I mentioned, the related downloads are here at the bottom of the page when you scroll. There's also some related links here, very helpful. There are frequently asked questions and answers. Also a link to the NCCI policy manual for Medicare services, that great manual that I talked about a little bit earlier with all of that great information. And then of course, if you're like me, as I mentioned, if you're on the CMS website, you can simply type NCCI for National Correct Coding Initiative into the search, and this will bring back the results for that particular search. So if you know that you want to view the medically unlikely edits, you can choose this. If you want to look at the manual, you could choose this. Just a number of different ways to navigate to that important information on the CMS website about the National Correct Coding Initiative. All right, and remember, throughout this presentation, when I developed it, I made certain to add the hyperlinks to all of these great resources that I'm talking about and or demonstrating during today's presentation. So that's how you find NCCI medically unlikely edits. There are different types of medically unlikely edit tables to choose from when you navigate to that medically unlikely edits webpage. Practitioner MUEs apply to physician-submitted claims. Durable medical equipment or DME supplier MUEs apply to Part B claims that are submitted to the DME MACs. For these items, the HCPCS codes are alphanumeric, and they identify DME, durable medical equipment, prosthetics, orthotics, and supplies. And sometimes you'll hear us refer to this as DMEPOS, DMEPOS, the acronym for DME, prosthetics, orthotics, and supplies. These would be those alpha codes that appear on the jurisdiction list for DME MACs. That's how you know that those particular alpha codes are those codes that are submitted to the DME MAC for consideration of payment versus submitting to your Part AB MAC like WPS GHA. Edits that apply to all claims with types of bills listed here on this slide, shown in the last bullet there. Types of bills 13X, 14X, 85X, and 87X are those for MUEs that apply to hospital outpatient services. Here then is a slide that I've included to show an example of the practitioner service MUE table. I just chose practitioner services versus the DME MAC MUE table or the outpatient services table. But you can see that this is a table, the MUE table for practitioner services, and that it has 4 columns that are labeled A, B, C, and D. And the reason these are labeled as is I actually took this screenshot from a helpful tool, and it's a resource that I've mentioned later on in your presentation materials. And it's actually a Medicare Learning Network educational tool that CMS has developed. It's called How to Use the Medicare National Correct Coding Initiative and NCCI Tools. There's a table of contents that you can use here, located over on the left, or there's some quick jumps here. If you're looking for procedure to procedure code pair edits, that's another type of NCCI edit. Or if you want to filter procedure to procedure data, if you're looking for MUEs, these are some just quick jumps to take you to various parts of this educational tool, which is available online. So I chose to jump to the information for looking up MUEs, and this is what it looks like. And I mentioned to you that I took a screenshot from this great resource, and right here it is. So I just simply cut and pasted this into my presentation materials, and that's what you're looking at here. So let's take a look then, or let's focus, I guess I should say, or explain what do those columns mean? Column A, column B, C, and D. And once again, I'm going to pull it back over here to show you what it looks like. If you actually scroll to the bottom of the MUE webpage and you choose those practitioner MUEs, this is what you're going to see. Okay. So here then, in your presentation materials, are explanations for column A, B, C, and D. Column A is titled HCPCS CPT code, and this is what shows those codes with a published medically unlikely edit value. Not all of them are published, or there are not MUEs published for all HCPCS or CPT codes. Some of them are confidential. Column B is titled Practitioner Services MUE Values, and this shows the maximum units of service that you would report under most circumstances for a single patient on a single date of service. And remember, these are not utilization parameters. Column C is titled MUE Adjudication Indicator. That's MAI, Medicare, or excuse me, MUE Adjudication Indicator. And this is the column that describes the level of adjudication of the MUE during that claims processing process. Column D is titled MUE Rationale, and this provides the rationale for each medically unlikely edit. Next, I want to talk a little bit more about column C, that MUE Adjudication Indicator column. This slide provides details on the MUE Adjudication Indicator, or MAI, that appears in column C. MAIs are assigned to each HCPCS code, each code that appears in the table. And MAI 1 indicates that a value adjudicated by claims processing systems at the claim line level. And MAI 2 indicates an absolute date of service edit based on policy. This could be an anatomic consideration. Maybe it's based on the definition of the code, or even something that's published in CMS policy. This means if there's an MAI 2 in column C, that no payment will be made for units of service in excess of the MUE. This is a hard-coded edit in the multi-carrier system. So if you're billing in excess of the units of service and there's an MAI 2 indicator, that means that Medicare will absolutely not pay more than that MUE. That could be an indicator to you that you don't need to request an appeal. For an MAI 3, this indicates a value that's adjudicated by claims processing systems at the date of service level. If claims denied based on these edits are appealed, MACs can consider payment or may pay units of service in excess of the MUE value, but only if there's adequate documentation of medical necessity of the correctly reported units. Remember that MAIs are not coding modifiers. The MUE tables do not have a column for modifiers. If you're seeking guidelines for using modifiers, I would recommend that you check out the many fact sheets that we have available on our website, and I've asked Ellen to place the link to our modifiers webpage into the chat. This was one of the questions that was pre-submitted, if you will, during registration process. You might remember when you registered for this event that we asked you, what one thing do you want to learn, or what question do you have that you want to be answered? Some of the registrants for today's webinar asked or mentioned that they wanted information on modifiers. And MAIs are not coding modifiers, and we're not including modifier education in today's webinar, but I provided for you, and Ellen placed it into the chat, that link to the modifiers webpage that will help you determine when to and when not to use a modifier on a claim that you're submitting to WPS GHA. We have a number of modifier recordings available out on our WPS GHA YouTube channel. We continue to offer live Modifier Monday webinars once a month, and we choose the modifiers that we want to focus on based on the provider feedback we receive. And that's received in a number of ways. A little bit later on in today's presentation, I'm going to ask you to complete a survey. And by completing that survey, this gives you an opportunity to tell us about things you want us to talk about in the future. So for those of you that mentioned modifiers, we didn't advertise that we were going to talk about modifiers today, but we do have a lot of resources available. If there's specific education on specific modifiers you want, please let us know, and you can do so by completing that survey. So what this boils down to is if you're looking at column C on an MUE table and there's an MAI 2, that means there's an absolute date of service edit, and there's a reason for it. It's based on policy, anatomic considerations, definition of code, so on and so forth. That means that the Medicare claims processing system will absolutely not pay in excess of the MUE. If there's an MAI 3 indicated, that means that you may appeal any denial that you might receive, and that we can consider payment of units of service more than an MUE, but we're only going to do that if the documentation justifies medical necessity and shows that you correctly reported the units. All right. CMS published a transmittal. It is transmittal 1420, and it provides MAI instruction and explanations, and they've also published, CMS is that, an MLN or Medicare Learning Network Matters number MM8853, and this Medicare Learning Network Matters number MM8853 is titled Revised Modification to the Medically Unlikely Edit Program. This particular MLN article or resource contains current and updated background information for modifications, and the updates actually include some clarifications, provides for you some general processing instructions, and detailed explanations of MUE requirements and then the specifications. If you are not aware of this transmittal or this Medicare Learning Network Matters article, CMS does recommend to make sure that your billing staffs are aware of this information. I mentioned to you that providers may request an appeal for denials that show for services with an MAI 3. Do not submit appeals to the NCCI contractor. You can find instructions for submitting each of the 5 levels of appeal on CMS Appeals webpage. We also have a resource on our website, and I've included the link here. It's called How to Appeal a Claim Determination, and in this resource we provide details on how to submit a level 1 appeal, and that level 1 appeal is called a redetermination. Redeterminations are the only level of appeal that are made by the MAC or by WPS GHA. One of the questions we received when learners registered for today's webinar, as I mentioned earlier, is how do you submit a claim for a service that exceeds the MUE? And of course, the MUE that must show would be an MAI 3 as opposed to an MAI 2. And the answer to that is that for WPS claims, you would submit the service on 2 lines. So for example, if the MUE is 3 and you provided 5 services, your documentation, of course, would need to show that all 5 services were medically necessary and that indeed 5 of them were done, or 5 units of service is correct. You would submit 3 units of service on one line, and then 2 units of service on another line. And of course, what's going to happen during claims adjudication because of that MUE edit and that MAI 3 is the excess units of service are going to be denied or will deny, and you will need to appeal the additional 2 units of service. If the MAI 2 indicator shows, however, there's no need to submit an appeal because it's a hard-coded edit and we cannot consider payment on an appeal. All right. When viewing NCCI edit tables, make certain you download the table of choice based on the correct effective date. There may be situations, as I mentioned earlier, that you will need to access an archived file. Another thing to consider when viewing NCCI MUE edit tables or any of the edits on CMS's NCCI web pages is that you may need unzip software in order to view those tables. Zip files are used to simplify the download process by wrapping a number of separate files into a single wrapper and compressing the original files by a significant amount. Zip and unzip software is available from a variety of vendors, and CMS actually provides links to download free packages on their help webpage. These are called Stuff It, Expander, and Unzip, and I've included the link here for you in case you're interested in that free package or free downloads for Unzip software. I mentioned to you and actually showed you already this great resource, the Medicare Learning Network booklet. I recommend it if you're seeking information on how to use the Medicare National Correct Coding edits, any of them, not just the medically unlikely edits, of course. This book covers them all. This MLN product includes really easy to understand language and the steps that you take to view the edits. There's also illustrations included, and who doesn't like pictures, right? Another great example of the CMS Medicare Learning Network products that are available. They do a tremendous job in publishing these. One of the things that you do want to keep track of a little bit is the date on these products. CMS does from time to time update the information. So, make certain that you're looking at that product that is the most current product published by CMS. I showed you already where you can find the NCCI frequently asked questions. I've included on this particular slide a link to the NCCI frequently asked question library webpage. When you look at this webpage, you're going to see the FAQs arranged by categories. The categories are listed here on this slide and include, billing and coding advice, medically unlikely edits, NCCI modifiers, just to name a few. So these are the categories of frequently asked questions available in the CMS frequently asked questions on their website. I talked a little bit about the National Correct Coding Initiative contractor, or the NCCI contractor, earlier. I specifically told you if you submit an appeal on a claim that was denied because of medically unlikely edits, you do not submit the appeal to the NCCI contractor. This slide actually shows some information about the NCCI contractor. They work, closely with CMS to maintain the edits and such. They do have a contract with CMS. If you have questions about the program itself, including those related to an edit or suggestions for a change to an edit, you can actually send them in writing to the email that I've included on this slide. Remember though, do not include any PHI, protected health information, or PII, personally identifiable information, when you're submitting an email to the NCCI contractor. All right, that brings us to questions, or time for questions. And I'll ask Ellen if we have received any questions.
Mary, we have received a question, and several questions. And the first question says, if you have two blocks, and this is an anesthetic block, that were done interscalene and supraclavicular, I don't think I pronounced that right, both code to a 64415, and it has an MUE of 1. How would you bill this in order to capture both of the anesthetic blocks?
You would consider the use of a modifier, and I mentioned to you those modifiers, the modifier fact sheets that are available. And if there is an anatomic modifier or consideration, then we may be able to pay the additional service as long as the MAI indicator for that CPT code is a 3.
Okay, and then the next question, and I think you kind of answered this one. Let me scroll back down to it here. When you are submitting on different lines of service, as you just instructed, are there modifiers that you can include that could allow for payment?
Well, that's going to be based on the information that's in your medical record documentation. You can append a modifier whenever it's appropriate to do so. And yes, it could be helpful when we're making decisions and determinations on whether to allow those units that are in excess. So yes, modifiers could be helpful, but it would depend on what's in your documentation.
Okay, and then the next question that we have really goes back to when you are billing for excess units of the MUE value, Your instructions, of course, were to bill on separate lines. And so the question says the MUE value is 1 and we bill 2 units. We are denied both units even though 1 unit is allowable. She goes on to say we have tried splitting the lines and putting the allowable unit on one line and non-allowable on the second. And we are still denied all units since this is a data service edit. I'm still reading here. We have understood in the past that we should bill all units that we perform, even if over the MUE value. We appeal to try and get paid on only the MUE allowable value, but are still not successful. Do we need to be billing only 1 unit, even though we have performed 2? Any tips for this is appreciated.
All right. Well, you've given me a lot of information, and I can tell you or provide some recommendations. Number one, since this is a claim-specific denial, and it sounds like it's happening often, what I would like to propose here is that you submit to us an ICN example, because I can't begin to tell you what happened to that claim during processing without looking at the claim itself. So it sounds questionable to me too that if there's an MUE of 1, that we're not paying for that one service. So that tells me there might be something else going on with that claim. And I can't tell you that without looking at the claim. That's why we typically tell you for claim-specific questions or provider-specific questions, you need to go to customer service, because customer service has access to those screens. But because this sounds like it's a problem that keeps happening, I do want to help you, and what I would recommend that you do, because I can't even begin to tell you what happened to that claim without looking or getting help. I can't look at those screens myself, but we can follow up after this. This is one of those situations where I need to do further research. So if you would please, I don't know who's submitting this because I can't see the chat box when I'm sharing my screen, but go ahead and submit to the education email box following this event, the ICNs. Give me a couple or 3 examples even if you have them, and please remember no PHI or no PII, and I will be happy to see what I can dig up for an answer on that. And I see that Ellen has entered that in. If you can do that, I'll be happy to do some further research. But right now, based on what you're telling me, it doesn't sound right that at least one of them isn't paying, but I would need to look at the claim. And thanks so much for doing that.
Okay, the next question that we have is, when the code is hard-coded, do providers ever use the non-covered charges on the claim? Or could they submit these, and I'm kind of paraphrasing here, could they submit these with a GY or a GX modifier?
If the modifier is appropriate based on the instructions on that fact sheet, go ahead and submit the modifier. Medicare doesn't require providers to submit charges for services that are excluded for coverage. But since this really isn't excluded from coverage, it's a coverable service, it's just that we can't pay more than one, I would include that on your claim.
Okay, our next question then, if there is a new procedure code for 2024 that has no MUE value, do we have to assume that it is only 1 per day?
No, that is not a correct assumption. Some of the MUEs are confidential and CMS never publishes them. Of course, we have the issue with a new code not having one assigned yet, but what you should do is submit the claim based on your medical record documentation, add any modifiers that are applicable, and submit the claim to Medicare for a payment determination. Of course, if it's an MAI indicator 2, it's hard-coded. Medicare pays for only one, but you said that the code wasn't assigned yet, or the MUE. So I would make certain that your documentation justifies what you're billing and the number of units that you're billing. Submit the services to Medicare. If there's a denial, you'll need to appeal.
Okay, thank you, Mary. The next question that we have is if we would like to ask the NCCI contractor to consider changing the MAI indicator from a 2 to a 3, for an example, or changing the values, is that when we would contact the NCCI contractor? And do you know if that has ever been done?
Yes, that is when you would contact the NCCI contractor. Um, my assumption is yes, it's been done. We have provided advice to providers in the past to contact the NCCI contractor. So here is, I'm showing you, here I pulled over the web page. This is the web page for the Medicare National Correct Coding Initiative edits. And of course, you can get to the different types of NCCI edits here, including MUEs, which is what we're talking about today. When you move down the page, this is where you'll find that contact information, and this is what I've placed into the presentation materials for today. But yes, I definitely would submit that information to the NCCI contractor. And of course, they're going to want your justification. So anything you have that would back up what you're asking them to do is going to be helpful.
Okay, and Mary, that's all the questions we have at this time.
All right, thanks, Ellen. Some great questions. Again, just as a reminder, I know there's been some questions about modifiers. It is correct coding to append a modifier when your documentation justifies the use of a modifier. So go ahead and use those modifiers if needed. It provides additional information when needed about the service that you're rendering. And there's a lot of those great fact sheets available out on our website. And of course, don't forget about those live Modifier Monday webinars that we're hosting, and give us some great ideas for specific modifiers you'd like covered in the future. I think I was looking just a couple of days ago, or earlier this week even, and noticed that there's a Modifier 25 webinar coming up shortly. And where you look to find those future live events would be the live events webpage on our website. And if you subscribe to our e-news, or if you're a listserv subscriber for WPS GHA, our Wednesday edition e-news is our training news. It goes out every Wednesday. It announces new webinars that we've published. It announces, new playlists that we've made additions to out on our YouTube channel. So if you subscribe, make certain you're opening those emails and reading them. We have a lot of subscribers, but not all of our subscribers are opening their email. Remember, it is a provider's obligation to submit correct claims. So if you subscribe, you should be reading those e-news announcements so that you can submit correct claims to Medicare. All right, lots of great questions. Thank you for them. Ellen, have any more questions come in?
Mary, we do have an additional question. And the question says the NCCI edit shows that the 99213 and the psychotherapy code cannot be performed on the same day. However, Medicare does allow this when it is billed by two different providers. It does seem contradictory that NCCI edit says these services are not payable on the same day, and WPS does pay for these.
All right, I think what you're talking about here is not an MUE, which limits the number of units you can bill on a day, but a procedure to procedure edit. And remember, and what I'm talking about, let me show you here real quick, since we don't have any more questions, at least not yet. This is another type of National Correct Coding Initiative edit, I believe, that you're talking about, and that is a procedure-to-procedure edit. I know that we've had some education on procedure-to-procedure edits. Today we're focusing on medically unlikely edits, but I do want to help you. The procedure-to-procedure practitioner edits are here at the bottom of the PTP edit page. And it shows if you're billing the code in column 1 and column 2, the same provider, same day, same patient. Sometimes the column 2 code service is going to bundle into payment for the column 1 service unless you use a modifier that's justified in your documentation. It sounds to me that this is a procedure-to-procedure edit situation. I would check these edits and then take any corrective action for procedure-to-procedure edits.
And Mary, just another quick question for you too. The procedure-to-procedure edits and the MUE edits are based on same physician, same patient, same date. Is that correct?
That is correct, and I'm so glad that you reminded me of that. Before I started answering, I thought, oh, I need to discuss that too, and then I forgot to do so. So thanks for that reminder. Yeah, these edits are based on same physician, and if a physician is in a group, same physician means same specialty. So that could mean that someone else within the group or organization with the same specialty is also billing on the same day. Medicare considers that as same physician, same provider. So the edits would apply in those situations when someone with the same specialty is rendering the service on the same day. And it is for that reason that there are modifiers that can modify the service, and then Medicare may or may not consider additional payment. Thanks, Ellen, for that. As I mentioned earlier, please stay informed, subscribe to and read our e-news. The messages we send are to make certain our providers have the latest information needed to prepare and submit correct claims to Medicare. So at this time, on behalf of myself and Ellen and all of Provider Outreach and Education, we do want to thank you for taking time to participate today, and we wish you a wonderful rest of your day. This concludes our webinar. You may now disconnect.